Hey folks, I wanted to talk about my recent experience with our lovely medical system. I will say it wasn't, I'm sure people have had worse, but this is I guess, my longest experience with it because I've never been in a hospital, never gone to, well, I've been to an emergency room once when I was a child. But this is something that went on for, and actually, I guess it's still going on, really for a couple of weeks, 3 weeks or so. All right, so let's get started here. I'm going to tell you what occurred, and I'm going to try to get the correct dates. On August 6th, I was at work and wasn't feeling well. This was about the end of the day, and I was feeling some pain. Something was going on when I was walking, and I just didn't feel well. So I came home and I set up on his phone, medical talks. You get to talk to the doctor, that sort of thing. It was for the next day. Well, the next morning I get up and I could barely get up. I'm like, let's put it this way, I had to strategically get up in order to not feel pain out of the bed. And the only thing I could tell was that part of me was swollen. I'll leave it at that because I don't want to get too graphic. And so briefly was on the phone with the person with the to do the phone telemedic, and they said no, just go straight to the emergency care, the urgent care. So all right, okay. So I go to urgent care. And unfortunately, there was hardly anyone there. I guess I got lucky. This was on Thursday, the 7th. And I go in, and of course, they do to take a sample and everything. And they say, oh, you got a UTI. I'm like, okay, all right. They give me, boom, let's send you some drugs. Okay, so I go get these drugs. I take them Thursday evening, Friday, Saturday. Saturday, I'm starting to feel a little bit better, okay? Another test result comes back. Nope, you're on the wrong medication. We got you some different antibiotics, so go get those. So, okay, so Sunday morning I go get these antibiotics. I start taking them. That's on the 10th. And by Wednesday, I actually felt worse. I felt like I went backwards. And Wednesday, I'm not going into work. I am still aching and feeling pain, having trouble getting in the shower. Just really can barely move around. Wasn't eating well. I called my regular doctor, okay? And over the phone, tell him everything's going on and all that. He thinks I have a hernia, possibly. He asked me if I had picked up anything heavy, and I said I had. I picked up about 13 boxes that weighed about 50 pounds each. Boom. Whoa, you may have a hernia. It says, go to the emergency room. So they tell me an emergency room to go to. I go there, and again, I get lucky. There's hardly anyone there. I don't know how I'm getting this lucky. So this is on the 13th. Haven't been to work. I go to this emergency room. They get me in there very quickly. I was only waiting maybe 15 minutes. Nice place. I have to say, this is Atrium Health I'm using here in North Carolina. And they get to work right on me. They basically take some more tests. They do a sonogram, I guess is what it's called. They use sound to, like they do with pregnant women. You know what I'm talking about. And so it comes back. I've got this thing happening down there and everything, and they hand me yet another antibiotic. So I've taken 3 antibiotics in 2 weeks. Now I stopped the first one, so I'm taking 2 now. And this second one they gave me, I'm already done with. I'm sorry I don't have one to show you, but this thing was huge. I had to break it in half to take it. And it was, so I'm taking 2 antibiotics now. The second one it was over and done at the end of this week, but the one they just gave me was going to be 2 weeks, so that was going to last me until the 27th. So I'm taking this stuff, and the third one they gave me actually did help me. I didn't have a hernia. I felt a lot better. I can't even say now on the second that I'm 100%. I'm like 98% now. So the emergency room says, we want you to follow up with your urologist. I'm like, yeah, okay, absolutely, I got you. So the first urologist they sent me to won't take my insurance. They're like, no, we can't do that. It's going to be out of pocket. I'm like, I'm not going to do that. And they can't get to me for 2 weeks anyway. The second one, aligned with Atrium Health, cool, takes my insurance, excuse me, but can't get to me until October. October 1st or something. I got the date somewhere. Yeah, it's October 2nd. So I'm like, okay, so I'm supposed to wait. At that time, it was like 5 weeks to get a follow-up. And in the meantime, I'm feeling pretty darn good. So I call my regular doctor and I say, dude, they won't follow up with me until October 1st. Can you at least see me and kind of check me out and tell me what the heck's going on? So he agrees. He gets me in there really quick. I went in, I think it was on the 26th I went in. And he looks at everything, and he's the first person to tell me, okay, here's what you got. I see this like usually twice a month. It's kind of a chicken and egg kind of thing. You either had a UTI or you had this, and it gave you the UTI. And I was like, yeah, okay, well, at least you're telling me something here. And he says, and I tell him, I'm like, I'm maybe 98% here. I'm still having occasionally some, not pain, but uncomfortable feeling. Let's put it that way. I'm not, ow, that sort of thing. He says, okay, so take anti-inflammatory. I was like, Motrin, okay? He says, yeah, take 600 milligrams 3 times a day. Whoa, okay. So got some Motrin, been taking that. And occasionally I've forgotten, and I had one day at work where I was working really hard. I mean, I was running. My Apple Watch was saying I did like 1,200 steps that day, and I was, I felt like, this could be coming back. So I don't know. Maybe I'll follow up on the first. Maybe I won't. It's the second now, so I've got a month. I don't know if I'll follow up or not. But all of this, it's run, go. I had, of course, my deductible with the emergency room that paid, and various drugs and that sort of thing. And it just seemed like there was poor communication between everybody. Now, I will say, my doctor, Stephen Nix, general practitioner, very good. Made sure I understood what was going on once he did see me, and I feel like he pointed me in the right direction. The whole thing with the guy over the phone and going to this urgent care was a waste of time. So that was money ill spent. The drug didn't even help me. And it just, it's... And then the first place they sent me to wouldn't even take my insurance. It's just a little frustrating. I will always be an advocate for universal health care. We're the only industrialized nation on the planet that doesn't have it. And it just frees up. It would be good for business too. Pro-business, great. Take healthcare out of business. We gave it to them, we pushed it into them because the government didn't want to pay for it. Okay, well, let's get universal health care going. I don't know. It's not probably going to happen in my lifetime, unfortunately. But that's the deal. I can tell you guys that apparently this happens to older men. And like I said, my doctor was saying he sees this twice a month, pretty much. So it is a lot more frequent than I thought. It was really bizarre and not fun. So anyway, there's my little rant. That's what's happening. If you guys have any suggestions, you think I should follow up with the urologist, let me know. I do have the appointment still, but I don't know. It just depends on how I feel like the week before. So that's it, guys. Thanks very much. And like and subscribe. You'll hear more stories from me in the future. Thanks very much. Bye.